I went into medicine because when I was a junior in high school, I dislocated my elbow playing football, and a local doctor took me back to his office during the game and put it back in place. And I was in so much pain, I thought about kissing the doctor, first of all, as soon as he did that. But also, I mean, if I could give that type of relief to somebody, that's what I want to do. So I made that decision when I was 17 on a Friday night. Well, I think a lot of people don't understand the assets that Bonheur has, mainly in the people that work here. I mean, we've got some of the most well-recognized surgical specialists, non-surgical specialists in pediatric care nationally and internationally. And when you see that from the inside, you know that you're not only going to get good care here, but you're going to get some of the best care in the country. So when you work on the inside as a resident, as I did when I was a resident, and now as a staff, you get to respect those people and get to see their commitment and their dedication and their expertise even more. So I think the big thing that people don't appreciate is the number of people that work at Bonheur that are leaders in their field. Part of being a level 1 trauma center not only means that you have to have a neurosurgeon, an orthopedic surgeon, a general surgeon available, an ICU nurse who's available, but also they have to be trained. So they have to be experts in trauma care. So one of the charges that I have as a director of trauma is I have to make sure that the neurosurgeons, orthopedic surgeons, emergency medicine physicians, my colleagues, the nurses, the respiratory therapists, anyone who's touching a trauma patient has a level of education they have to get every year, and they have to keep that updated. And part of my job is to make sure they get that education, and that they keep that updated, and that they remain current in trauma, even if they go for a time and don't see, some trauma patient, or they even rotate out of an area where they would see a trauma patient. An emergency room nurse, for example, sees lots of trauma patients, but if she then moves to the floor, if she's going to go back to the emergency room and work and see our patients, she's still got to be updated on the most recent trauma care education. And that's what we do as a trauma division. We make sure everybody in the hospital that's going to touch a trauma patient is up to date and knows how to take care of those patients.